Introduction to skin anatomy. The skin, the body's largest organ, serves as a crucial protective barrier against environmental aggressors, pathogens, and UV radiation. It plays a vital role in regulating body temperature, sensing touch, pressure, pain, and temperature, and synthesizing vitamin D. Understanding its intricate structure is fundamental for any aesthetic practitioner to ensure safe and effective treatments. The skin's complex layers and cellular components work in harmony to maintain its integrity and perform its diverse functions. Recognizing these foundational elements allows for a deeper appreciation of how various treatments interact with the skin. Proper knowledge of skin anatomy is the cornerstone of successful and responsible aesthetic practice. The skin is broadly divided into three primary layers: the epidermis, dermis, and subcutaneous tissue, each with distinct functions and compositions. The epidermis is the outermost protective layer, constantly renewing itself to shield the body from external threats. Beneath it lies the dermis, a thicker layer rich in connective tissue, blood vessels, nerves, and hair follicles, providing strength and elasticity. The deepest layer, the subcutaneous tissue, primarily composed of fat, insulates the body and stores energy. Each layer contributes uniquely to the skin's overall health and appearance, making their individual study essential for comprehensive understanding. Epidermis layers and functions. The epidermis, the outermost layer of the skin, is a stratified squamous epithelium, primarily composed of keratinocytes. It acts as the body's primary protective shield, preventing water loss and blocking the entry of harmful substances and microorganisms. This layer is avascular, meaning it contains no blood vessels and receives its nutrients from the underlying dermis. Its thickness varies across different body parts, being thickest on the palms and soles. The epidermis is in a constant state of renewal, with new cells forming at the bottom and migrating upwards to the surface. This continuous turnover is essential for maintaining skin health and integrity. The epidermis consists of 5 distinct layers in thick skin, palms and soles, and 4 in thin skin, each contributing to its protective function. The deepest layer is the stratum basal, where new keratinocytes are produced. Above it lies the stratum spinosum, characterized by desmosomes that provide strength. The stratum granulosum is where keratinization begins, and cells start to flatten. The stratum lucidum, present only in thick skin, is a clear layer. Finally, the stratum corneum, the outermost layer, consists of dead, flattened keratinocytes that form a tough, waterproof barrier. These layers collectively ensure robust protection and regulate skin hydration. Dermis structure and components. The dermis, located beneath the epidermis, is a robust layer composed primarily of dense, irregular connective tissue, providing the skin with its strength, elasticity, and flexibility. It houses a rich network of blood vessels that supply nutrients to both the dermis and the overlying epidermis, as well as nerve endings responsible for sensations like touch, pain, and temperature. Hair follicles, sebaceous glands, and sweat glands are also embedded within this vital layer, contributing to various skin functions. The dermis is crucial for maintaining skin hydration and supporting its structural integrity, making it a key target for many aesthetic treatments. The dermis is further divided into 2 main regions, the papillary layer and the reticular layer. The papillary layer, the superficial portion, is characterized by dermal papillae, which are small, nipple-like projections that extend into the epidermis, increasing the surface area for nutrient exchange and strengthening the epidermal-dermal junction. It contains loose connective tissue and fine collagen and elastic fibers. The deeper reticular layer is much thicker, consisting of dense, irregular connective tissue with thick bundles of collagen fibers, providing significant tensile strength. This layer also contains larger blood vessels, nerves, and various skin appendages, contributing significantly to the skin's overall resilience and function. Subcutaneous tissue and skin appendages. The subcutaneous tissue, also known as the hypodermis, is the deepest layer of the skin, situated beneath the dermis. is primarily composed of adipose, fat tissue, and loose connective tissue, serving several vital functions for the body. This layer acts as an insulator, helping to regulate body temperature by preventing heat loss. It also functions as an energy reservoir, storing fat that can be metabolized when needed. Furthermore, the subcutaneous tissue provides cushioning against physical trauma and anchors the skin to underlying muscles and bones. Its thickness varies significantly across individuals and body regions, influencing body contour and skin mobility. Skin appendages are specialized structures derived from the epidermis that extend into the dermis and sometimes the subcutaneous tissue, playing crucial roles in skin function. These include hair follicles, which produce hair and are associated with erector pili muscles that cause goosebumps. Sebaceous glands secrete sebum, an oily substance that lubricates the skin and hair, preventing dryness. Sweat glands, both eccrine and apocrine, are responsible for producing sweat, which helps in thermoregulation and waste excretion. Nails, another appendage, protect the fingertips and toes. Understanding these structures is important as they can be affected by or influence aesthetic treatments. General health and safety protocols. Adhering to stringent health and safety protocols is paramount in any aesthetic practice, especially when performing procedures like fibroblast plasma skin tightening. These protocols are designed to protect both the client and the practitioner from potential hazards, including infection, chemical exposure, and physical injury. Establishing a clean and sterile environment is the first line of defense against cross-contamination and the spread of pathogens. Regular training and strict adherence to guidelines are not just regulatory requirements, but ethical obligations. Maintaining a safe workspace fosters trust and confidence, ensuring a professional and secure treatment experience for everyone involved. Key health and safety measures include proper hand hygiene, sterilization of equipment, and appropriate waste disposal. Practitioners must always wash their hands thoroughly before and after each client interaction, and wear personal protective equipment, PPE, such as gloves, masks, and protective eyewear. All instruments that come into contact with the skin must be sterilized according to industry standards, and single-use items should be disposed of immediately in designated biohazard containers. Maintaining a clean and organized treatment area, regularly disinfecting surfaces, and ensuring adequate ventilation are also critical components of a safe practice. These practices collectively minimize risks and uphold the highest standards of care. First aid for aesthetic procedures. Even with the most meticulous planning and execution, minor incidents can occur during aesthetic procedures. Therefore, having a comprehensive understanding of basic first aid is indispensable for any practitioner. Prompt and appropriate first aid can mitigate the severity of an incident, prevent further complications, and ensure client comfort and safety until professional medical help arrives, if necessary. It is not just about treating injuries, but also about recognizing early signs of adverse reactions and responding effectively. Regular training in first aid, including CPR and anaphylaxis management, should be a mandatory part of continuous professional development for all aesthetic professionals. Essential first aid knowledge for aesthetic practitioners includes managing minor burns, cuts, and bleeding, as well as recognizing and responding to allergic reactions or fainting spells. For minor burns, immediate cooling with water is crucial. Small cuts should be cleaned and covered to prevent infection. In cases of severe bleeding, direct pressure should be applied. Practitioners must also be trained to identify signs of an allergic reaction, such as swelling or difficulty breathing, and know how to administer an epinephrine autoinjector if indicated. Maintaining a well-stocked first aid kit with essential supplies is also a non-negotiable requirement in any treatment setting. Preparedness is key to handling emergencies effectively. Absolute contraindications to treatment. Identifying absolute contraindications is a critical step in the client consultation process, as proceeding with treatment in these cases can lead to severe adverse reactions or complications. Absolute contraindications are conditions or circumstances that completely prohibit the performance of a specific aesthetic procedure due to inherent risks to the client's health and safety. Ignoring these warnings can result in irreversible damage, legal liabilities, and significant harm to the client's well-being. A thorough understanding and strict adherence to these contraindications are non-negotiable for ethical and responsible practice. Practitioners must prioritize client safety above all else, even if it means declining a treatment. Common absolute contraindications for fibroblast plasma skin tightening include pregnancy or breastfeeding, active skin infections, examples herpes simplex, bacterial infections in the treatment area, and a history of keloid scarring. Individuals with pacemakers or other implanted electrical devices are also contraindicated due to the electrical nature of the plasma device. Certain autoimmune diseases, uncontrolled diabetes, or a history of poor wound healing can also pose significant risks. Clients undergoing chemotherapy or radiation therapy, or those with severe cardiovascular disease, should also be excluded. A detailed medical history and honest client disclosure are essential to identify these critical factors, ensuring that only suitable candidates receive treatment. Relative contraindications and client assessment. Relative contraindications are conditions that may not completely prohibit a fibroblast plasma treatment, but require careful consideration, modification of the treatment plan, or a more cautious approach. These situations demand a thorough assessment and often a discussion with the client's physician to determine the safest course of action. Unlike absolute contraindications, relative ones might allow for treatment under specific circumstances, provided the potential risks are carefully weighed against the benefits and all necessary precautions are taken. The practitioner's expertise in judgment and communication becomes paramount in these cases, ensuring client safety remains the top priority while still striving to meet their aesthetic goals. Examples of relative contraindications include recent sun exposure or tanning, which can increase the risk of post-inflammatory hyperpigmentation. Clients with a history of cold sores may require antiviral prophylaxis before lip area treatments. Individuals on certain medications, such as blood thinners, might need to discontinue them temporarily under medical supervision to minimize bruising. Minor skin irritations, active acne, or recent aesthetic treatments in the same area also warrant careful evaluation. A comprehensive client assessment involves a detailed medical history, skin analysis, and an open dialogue about expectations and potential risks. This meticulous approach ensures that treatments are tailored to individual needs, maximizing safety and efficacy. Understanding blood-borne pathogens. Blood-borne pathogens, BBPs, are microorganisms such as viruses or bacteria that are carried in blood and can cause disease in humans. In an aesthetic setting, procedures involving skin penetration, even minimally, carry a risk of exposure to these pathogens. Understanding how BBPs are transmitted, their common types, and the diseases they cause is fundamental for implementing effective infection control measures. Practitioners must be acutely aware of this risk to protect themselves and their clients from potentially life-threatening infections. Education on BBPs forms a cornerstone of health and safety training in any medical or aesthetic environment, ensuring a safe practice for all. The most common and concerning blood-borne pathogens in a clinical setting include hepatitis B virus, HBV, hepatitis C virus, HCV, and human immunodeficiency virus, HIV. HBV and HCV can cause severe liver damage, including chronic hepatitis, cirrhosis, and liver cancer. HIV attacks the immune system, leading to acquired immunodeficiency syndrome, AIDS. Transmission typically occurs through contact with infected blood or other potentially infectious materials, OPIM, such as semen, vaginal secretions, or cerebrospinal fluid. This contact can happen through needle stick injuries, cuts, mucous membrane exposure, or non-intact skin. Preventing exposure is paramount to safeguarding health. Prevention and infection control. Effective prevention and infection control strategies are crucial to minimize the risk of bloodborne pathogen transmission in aesthetic practices. Universal precautions, which treat all human blood and certain body fluids as if they are known to be infectious, form the foundation of these strategies. Implementing these precautions consistently protects both clients and practitioners from potential exposure. A proactive approach to infection control not only ensures regulatory compliance, but also builds client confidence and maintains the highest standards of professional care. Continuous vigilance and adherence to established protocols are non-negotiable for a safe working environment. Key infection control measures include proper hand hygiene, using personal protective equipment, PPE, safe handling and disposal of sharps, and thorough cleaning and disinfection of surfaces and equipment. Practitioners must wash hands frequently and thoroughly, especially before and after client contact and after removing gloves. Wearing appropriate PPE, such as gloves, masks, and eye protection, creates a barrier against exposure. Sharps, like needles, must be immediately disposed of in puncture-resistant, labeled sharps containers. All non-disposable equipment must be sterilized or high-level disinfected, and environmental surfaces must be regularly cleaned with EPA-registered disinfectants. These combined efforts create a robust defense against infection. Client consultation process. The client consultation is arguably the most crucial step in any aesthetic treatment journey, serving as the foundation for a successful and safe outcome. It is an opportunity to build rapport, understand the client's aesthetic goals, and thoroughly assess their suitability for fibroblast plasma skin tightening. This initial interaction allows the practitioner to gather essential medical history, identify potential contraindications, and discuss realistic expectations. A well-executed consultation ensures that both the client and practitioner are aligned on the treatment plan, minimizing misunderstandings and maximizing client satisfaction. It is a comprehensive dialogue that prioritizes client safety and informed consent. A thorough consultation typically involves several key components. Firstly, a detailed medical history form must be completed, covering past and present health conditions, medications, allergies, and previous aesthetic treatments. Secondly, a comprehensive skin analysis is performed to evaluate skin type, concerns, and overall condition. Thirdly, the practitioner must clearly explain the fibroblast plasma procedure, including its mechanism, expected results, potential risks, and downtime. Finally, a discussion about the client's desired outcomes and realistic expectations is essential, ensuring that the treatment plan is tailored to their individual needs and that they have a clear understanding of what to expect. This holistic approach ensures ethical and effective practice. Managing client expectations and consent. Managing client expectations is a critical aspect of the consultation process, directly impacting client satisfaction and the reputation of the practice. It involves clearly communicating what the fibroblast plasma treatment can realistically achieve, as well as its limitations. Overpromising or failing to address unrealistic expectations can lead to disappointment and negative feedback, regardless of the technical success of the procedure. Practitioners must engage in an honest and transparent dialogue, ensuring clients have a balanced understanding of potential outcomes, including the gradual nature of results and the possibility of needing multiple sessions. This open communication builds trust and sets the stage for a positive client experience. Obtaining informed consent is a legal and ethical imperative that follows a thorough discussion of expectations, risks, and benefits. The informed consent form is a legal document that confirms the client has received and understood all pertinent information regarding the fibroblast plasma treatment. It should detail the procedure, potential side effects, e.g. swelling, redness, scabbing, downtime, alternative treatments, and the client's right to withdraw consent at any time. The client must sign this document voluntarily, demonstrating their full understanding and agreement to proceed. This process ensures that clients make autonomous decisions about their treatment, fully aware of all implications, and protects the practitioner legally. Understanding the Fitzpatrick scale. The Fitzpatrick scale is a numerical classification scheme for human skin color, developed in 1975 by Thomas B. Fitzpatrick. It categorizes skin types based on their response to sun exposure, specifically their tendency to burn or tan. This scale is an invaluable tool in aesthetic medicine, helping practitioners assess a client's risk for various treatment-related complications, particularly post-inflammatory hyperpigmentation, PIH, or hypopigmentation. Understanding a client's Fitzpatrick skin type is crucial for customizing treatment parameters, selecting appropriate techniques, and predicting healing outcomes. It allows for a more personalized and safer approach to fibroblast plasma skin tightening, minimizing adverse effects and optimizing results. The scale ranges from Type 1, very fair skin, always burns, never tans, to Type 6, deeply pigmented dark skin, never burns, always tans. Types 1 and 2 are highly susceptible to sunburn and have a higher risk of PIH following aggressive treatments. Types 3 and 4 show moderate tanning ability and a lower but still present risk of PIH. Types 5 and 6, with their higher melanin content, rarely burn and tan easily, but are still prone to PIH, which can be more challenging to treat. Accurately determining a client's Fitzpatrick skin type through careful observation and questioning is a fundamental skill for any aesthetic practitioner, guiding treatment choices and aftercare recommendations effectively. Identifying key body landmarks and contour. A precise understanding of body landmarks and anatomical contours is essential for achieving optimal and symmetrical results with fibroblast plasma skin tightening. Accurate identification of these landmarks allows practitioners to plan treatment areas effectively, ensuring even application and avoiding critical structures like nerves, blood vessels, and bones. This anatomical knowledge guides the practitioner in creating a natural-looking lift and tightening effect, respecting the individual's unique facial and body architecture. Without this foundational understanding, treatments can appear unnatural, asymmetrical, or even cause unintended harm. It is a critical skill that underpins the artistry and safety of aesthetic procedures. For facial treatments, key landmarks include the orbital rim, zygomatic arch, mandibular line, and various muscle insertion points. Understanding the natural curves of the eyelids, the definition of the jawline, and the contours of the neck is vital for precise application around these delicate areas. On the body, landmarks such as the navel, hip bones, and natural creases or folds guide treatment for areas like the abdomen or arms. Practitioners must develop a keen eye for symmetry and proportion, using these anatomical guides to map out treatment grids and ensure consistent dot placement. This meticulous approach to mapping and contouring is what differentiates a skilled practitioner and leads to superior aesthetic outcomes. Clinic and equipment preparation. Thorough preparation of the clinic environment and all necessary equipment before a fibroblast plasma treatment is fundamental for ensuring safety, efficiency, and client comfort. A well-organized and sterile workspace minimizes the risk of infection and allows the practitioner to focus entirely on the procedure. This meticulous setup also projects professionalism and competence, instilling confidence in the client. Neglecting any aspect of preparation can lead to delays, compromised hygiene, or even procedural errors. Therefore, establishing a systematic pre-appointment routine is a cornerstone of responsible aesthetic practice. Pre-appointment setup involves several key steps. Firstly, the treatment room must be thoroughly cleaned and disinfected, including all surfaces, chairs, and equipment. Secondly, all necessary supplies should be gathered and arranged ergonomically, including the fibroblast plasma pen, sterile disposable tips, topical anesthetic, antiseptic solution, gauze, and aftercare products. The plasma pen itself must be checked for proper function and charged if necessary. Client comfort items, such as blankets or pillows, should also be prepared. Finally, the practitioner must ensure their personal protective equipment, PPE, is readily available and donned correctly before the client enters the treatment area. This comprehensive preparation ensures a smooth and safe treatment experience. Fibroblast plasma pen principles. The Fibroblast plasma pen utilizes a groundbreaking technology that harnesses the power of plasma to achieve non-surgical skin tightening and rejuvenation. The device generates a tiny, controlled electrical arc, known as a plasma flash, when brought close to the skin's surface without direct contact. This plasma flash ionizes gases in the air, creating a small, superficial thermal trauma to the epidermis. This controlled injury triggers the body's natural healing response, leading to the contraction of skin fibers and the stimulation of new collagen and elastin production. Understanding this mechanism is key to appreciating the efficacy and safety of the treatment. The plasma flash creates tiny, superficial carbon crusts or dots on the skin's surface, which are strategically placed to achieve the desired tightening effect. These dots cause immediate sublimation of the superficial skin cells, meaning they turn directly from solid to gas, without causing thermal damage to the surrounding tissue. The subsequent healing process involves significant collagen remodeling and neocollagenesis, resulting in firmer, smoother, and more youthful-looking skin over several weeks. The precision of the plasma pen allows for targeted treatment of specific areas, making it highly effective for addressing fine lines, wrinkles, and skin laxity with minimal downtime compared to surgical alternatives. Treating the eye area. The eye area is one of the most popular and effective regions for fibroblast plasma skin tightening, addressing concerns such as hooded eyelids, crow's feet, and under-eye bags. Due to the delicate nature of the skin around the eyes, extreme precision and a thorough understanding of periorbital anatomy are paramount. The treatment aims to create a subtle lift and tightening effect, opening up the eye area and reducing the appearance of wrinkles. Careful client assessment is crucial to ensure suitability, especially considering skin laxity and any pre-existing conditions. This delicate procedure demands a skilled hand and meticulous attention to detail. When treating the eye area, specific techniques and considerations apply. A topical anesthetic is essential to ensure client comfort. The plasma dots are strategically placed in a grid pattern, typically along the orbital rim and within the crow's feet lines, avoiding the movable eyelid and lash line to prevent complications. The energy settings of the plasma pen must be carefully adjusted to suit the thin, sensitive skin. Post-treatment, significant swelling is common around the eyes, and clients must be thoroughly educated on aftercare, including gentle cleansing and avoiding makeup until the carbon crusts fall off naturally. Patience during the healing process is key for optimal results in this highly visible area. Treating the neck and jawline fibroblast plasma skin tightening is highly effective for addressing concerns in the neck and jawline area, such as sagging skin, turkey neck, and loss of definition along the mandibular line. These areas often show early signs of aging due to gravity and collagen loss, making them popular targets for rejuvenation. The treatment aims to create a firmer, more contoured appearance, enhancing the natural lines of the jaw and neck. A comprehensive assessment of skin laxity and fat distribution is essential to determine the most effective treatment strategy and manage client expectations regarding the degree of tightening achievable. When treating the neck and jawline, the practitioner must carefully map out the treatment area, often using a grid pattern to ensure even shrinkage and lifting. The plasma dots are strategically placed to follow the natural contours, focusing on areas with significant laxity. Particular attention is paid to the submental area, under the chin, and along the jawline to enhance definition. The energy settings may need to be adjusted based on skin thickness and sensitivity in different parts of the neck. Post-treatment, clients can expect swelling and carbon crusts, and clear aftercare instructions are vital for proper healing and optimal results. The goal is to achieve a smoother, more youthful neck and a sharper, more defined jawline. Treating the face, forehead, cheeks, fibroblast plasma skin tightening can effectively address various concerns across the face, including forehead lines, frown lines, and laxity in the cheek area. The treatment provides a non-surgical alternative to reduce the appearance of wrinkles and improve overall skin texture and firmness. Careful assessment of facial muscle movement and existing lines is crucial for achieving natural-looking results. Practitioners must consider the client's unique facial expressions and contours to ensure the treatment enhances their features without creating an unnatural or frozen appearance. This requires a blend of anatomical knowledge and artistic sensibility. When treating the forehead, plasma dots are strategically placed along horizontal lines and between the eyebrows to reduce frown lines, being mindful of the underlying muscle activity. For the cheeks, treatment focuses on areas of laxity, often in a lifting pattern towards the temples or along the nasolabial folds to soften their appearance. Topical anesthetic is always applied to ensure comfort. The energy settings are adjusted based on skin thickness and the severity of the concern. Post-treatment, clients will experience carbon crusts and swelling, and strict adherence to aftercare instructions is essential for optimal healing and the gradual emergence of tighter, smoother skin. Patience and consistent aftercare are key to achieving the desired facial rejuvenation. Treating the body, abdomen, arms, Fibroblast plasma skin tightening extends beyond facial treatments, proving effective for various body areas experiencing skin laxity, such as the abdomen and arms. Post-pregnancy, significant weight loss or natural aging can lead to loose skin on these areas, which can be challenging to address with diet and exercise alone. Plasma treatment offers a non-surgical solution to tighten and firm these regions, improving overall body contour and skin texture. A thorough assessment of the client's skin elasticity, the extent of laxity, and the presence of stretch marks is crucial for developing an appropriate and effective treatment plan. When treating the abdomen, plasma dots are typically applied in a grid pattern across the lax skin, often focusing on the area around the navel and lower abdomen to create a smoother, tighter appearance. For the arms, particularly the inner upper arms, often referred to as bat wings, dots are strategically placed to induce skin contraction and firm the area. Due to the larger surface area, these body treatments can require more time and potentially multiple sessions to achieve optimal results. Clients must be prepared for a longer healing period and more extensive aftercare compared to smaller facial areas. Clear communication about expectations, downtime, and the importance of consistent aftercare is paramount for client satisfaction and successful outcomes on the body. Advanced techniques and settings. Mastering fibroblast plasma skin tightening involves not only understanding the basic principles, but also developing proficiency in advanced techniques and adjusting device settings for diverse client needs. Different skin types, areas of the body, and specific concerns require varied approaches to achieve optimal results while ensuring safety. Advanced practitioners learn to manipulate factors such as power levels, dot placement density, and treatment patterns to customize each session. This nuanced understanding allows for greater versatility and effectiveness, moving beyond standard protocols to address complex aesthetic challenges. Continuous education and practical experience are vital for developing these advanced skills. Advanced techniques include specialized dot patterns for specific concerns, such as linear patterns for deep wrinkles or cross-hatching for significant skin contraction. Practitioners also learn to vary the distance between dots and the depth of the plasma flash by adjusting the device's power settings and the angle of approach. For example, lower settings and wider spacing might be used for delicate areas or lighter skin types, while higher settings and denser patterns could be employed for tougher skin or more severe laxity on the body. Understanding the interplay between these variables allows for precise control over the treatment's intensity and outcome, ensuring tailored and effective results for each unique client presentation. Treating stretch marks, wrinkles, scars, the Fibroblast Plasma Pen offers a versatile solution for improving the appearance of various skin imperfections beyond just tightening, including stretch marks, deep wrinkles, and certain types of scars. The controlled thermal trauma induced by the plasma flash stimulates collagen remodeling and cellular regeneration, which can significantly improve skin texture and elasticity in these challenging areas. While results may vary depending on the severity and age of the imperfection, many clients experience noticeable improvement in the smoothness and overall appearance of their skin. This broad applicability makes the plasma pen a valuable tool in a comprehensive aesthetic practice. For stretch marks, the plasma dots are typically placed directly along the striae, aiming to stimulate collagen production and contract the stretched skin, leading to a smoother, less noticeable appearance. When treating deep wrinkles, the dots are strategically placed within and around the wrinkle lines to induce localized tightening and collagen synthesis, effectively softening their depth. For scars, particularly atrophic depressed scars, the treatment can help to remodel the collagen and elevate the scar tissue, improving its texture and blending it more seamlessly with the surrounding skin. Each application requires careful assessment and customized treatment parameters to achieve the best possible outcome, emphasizing the importance of practitioner skill and experience. Skin tags and tattoo removal. Beyond skin tightening, the Fibroblast plasma pen can also be utilized for the removal of certain benign skin lesions, such as skin tags, and in some cases, for superficial tattoo removal. The principle remains the same. The plasma flash causes sublimation of the targeted tissue, effectively removing the unwanted growth or pigment. This offers a non-invasive or minimally invasive alternative to traditional surgical excision or laser treatments for specific indications. Practitioners must be thoroughly trained in identifying appropriate lesions for treatment and understanding the limitations of the plasma pen for these applications. Accurate diagnosis and client selection are paramount to ensure safety and efficacy. For skin tag removal, the plasma pen is used to precisely sublimate the base of the tag, causing it to detach and fall off within a few days. This method is generally quick and leaves minimal scarring. For superficial tattoo removal, the plasma pen can be used to break down the pigment in the outermost layers of the skin, leading to a gradual fading of the tattoo. However, it is important to note that plasma pen tattoo removal is typically less effective for deep, professional tattoos and may require multiple sessions. It is most suitable for small, superficial, or cosmetic tattoos. Practitioners must clearly communicate these limitations to clients and manage expectations, ensuring they understand the scope and potential outcomes for both skin tag and tattoo removal procedures. Immediate post-treatment care. Immediate post-treatment care is crucial for optimizing healing and ensuring the best possible results following a fibroblast plasma procedure. The period immediately after treatment is characterized by swelling, redness, and the formation of tiny carbon crusts, dots, on the skin surface. Proper care during this initial phase helps to minimize discomfort, prevent infection, and support the natural regeneration process. Clients must be thoroughly educated on what to expect and how to care for their treated skin in the hours and days following the procedure. Clear and concise instructions are paramount to ensure adherence and successful healing. Key immediate aftercare instructions include keeping the treated area clean and dry for the first 24 to 48 hours, avoiding any contact with water or excessive sweating. Clients should be advised not to pick or scratch the carbon crusts, as this can lead to scarring or infection. A gentle, non-occlusive aftercare balm or cream, specifically recommended by the practitioner, should be applied sparingly to aid healing and keep the skin moisturized. Sun exposure must be strictly avoided, and a high SPF sunscreen should be used once the crusts have fallen off. Swelling can be managed with cool compresses, and over-the-counter pain relievers can be used for discomfort. These steps are vital for a smooth and effective recovery, setting the stage for long-term results. Client aftercare, long-term instructions. Long-term client aftercare is just as important as immediate post-treatment care for ensuring optimal and lasting results from fibroblast plasma skin tightening. Once the initial healing phase is complete and the carbon crusts have naturally fallen off, the skin continues its regeneration and collagen remodeling process for several weeks and even months. Proper long-term care helps to protect the newly formed skin, support ongoing collagen production, and prevent complications like hyperpigmentation. Educating clients on these sustained practices empowers them to actively participate in their healing journey and maximize the benefits of their treatment. Key long-term aftercare instructions include diligent sun protection, consistent hydration, and the use of recommended skincare products. Clients must apply a broad-spectrum SPF 30+ sunscreen daily, even on cloudy days, to protect the delicate new skin from UV damage and prevent post-inflammatory hyperpigmentation. Keeping the skin well hydrated with a gentle, non-irritating moisturizer is essential for maintaining skin barrier function. Practitioners should recommend a personalized skincare regimen that supports collagen production and skin health, often including products with ingredients like hyaluronic acid, vitamin C, and peptides. Clients should also be advised to avoid harsh exfoliants or aggressive treatments for several weeks or months, as directed by the practitioner. Regular follow-up appointments allow the practitioner to monitor healing progress and adjust aftercare as needed, ensuring the best possible long-term outcome. Troubleshooting and follow-up. Even with the most diligent care, clients may occasionally experience unexpected reactions or have concerns during the healing process. Therefore, practitioners must be equipped to troubleshoot common issues and provide clear guidance. This includes recognizing signs of normal healing versus potential complications and knowing when to advise a client to seek medical attention. Effective troubleshooting and responsive communication are vital for managing client anxiety and ensuring their safety and satisfaction. A proactive approach to addressing concerns reinforces trust and demonstrates professional responsibility, solidifying the client-practitioner relationship. Common issues that may arise include prolonged swelling, excessive redness, itching, or delayed shedding of carbon crusts. Practitioners should provide clear instructions on how to contact them with concerns and offer prompt, empathetic responses. For persistent swelling or redness, gentle cool compresses and anti-inflammatory advice may be given. If signs of infection, e.g., pus, spreading redness, fever, appear, the client must be immediately referred to a physician. Follow-up appointments are crucial, typically scheduled a few weeks after the initial treatment, to assess healing progress, evaluate results, and address any lingering concerns. These appointments also provide an opportunity to discuss potential touch-up treatments or future aesthetic plans, ensuring continuous client care and satisfaction.